All right, man, has it been a crazy week if you're a hypochondriac or if you are just a follower of health news. You don't have to be a hypochondriac like me to follow health news. So many things that I have always believed are right are now we're told are wrong. And this, in my view, is a continuation of where we've been heading for some time. Joining us now to talk about all this is the star of House Calls on the Fox News Channel Sunday mornings at 10:30 Eastern, Dr. David Samadi, chairman of Urology and chief of robotic surgery at Lenox Hill Hospital. Hello, doctor.
How are you, Steve?
I'm good. You know why? Because I took my multiple. I took my vitamin D. I took my a homocysteine modulator, which is B complex and folic acid. I took my E and selenium. I took my fish oil. That's why I'm good. And here I got a study, which has been rocking the place the whole week, that say, oh, stop taking vitamins because you're wasting your money. You're throwing your money away. What's going on?
Okay, so basically, everything that you said about the multivitamins, we like it. We want people to take multivitamins, but you have to understand, why are you taking the multivitamins? For most of us, where you have a balanced diet, you're getting enough vegetables, you're getting all of your vitamins, you get your minerals, you have, the appropriate breakfast, you exercise, your nutritions are there, then multivitamins, it's not going to really help you because you already got it from the appropriate diet. The problem with this country is that we don't have a balanced diet, and a lot of us are not really taking the right stuff. We don't have enough breakfast. We don't eat the right food. We may eat a lot of fatty food and not get enough vegetables, and that's when we recommend people take multivitamins. So that's why the idea here is that the more is not merrier. The fact that you're taking so many multivitamins and other vitamins, that doesn't really help you unless you're deficient and you need it. And that's why I always recommend taking a multivitamin, because it's a really good mix of a dozen vitamins in one, especially for someone like myself that I don't have the time to really sort out 12, 15 different vitamins and make all these, bottles and packages, etc. One multivitamin for me, I work hard, I have time limitations, and I may not get always my 7 hours of sleep, so I need that extra vitamin B complex. But for most people, they may or may not need it. That's what this study is about.
Yeah, no, I hear you. And, for me, it's my grandmother took vitamins. My parents always took vitamins and raised me on, to take vitamins when I became an adult or whatever. And I've always taken them. So, I mean, and they have a pretty good track record with longevity. So, so I'm figuring, what the heck?
That's right. But, Steve, the only other thing that I want to add to this is, for the most part, a lot of fat-soluble vitamins may or may not hurt you because they get dissolved and you basically excrete them and there's no problem. Sometimes such vitamins such as vitamin E, a lot of them we're finding out that it can cause prostate cancer.
Right.
We are finding out that too much fish oil may not be good for you.
Right, and I've cut back on both of those, actually.
Exactly.
Yeah.
And so I encourage you to take your salmon, your tuna, your legumes, and all of those are actually healthy. Nuts is great for you, but too much of it may have a reverse effect.
Right.
That's another thing.
Right.
When you see a lot of your friends in the parties, they say, oh, I take all these vitamins, start taking them. That's a wrong way. We have to see what is your chemistry, what is your formula, and then stick to it.
Oh, I never tell people to take them. I just say, if they ask me if I tell them. But I say, call Dr. Samadi. He'll tell you what to do. Now, Doc, this is now you tell me if I'm wrong here. We've talked about over the years. First, the recommendations, women, don't get a mammogram at 40, get it at 50. Don't get it every year, get it every 2 years. Men, prostate, don't take a PSA test. You're all going to get prostate cancer anyway. All these crazy recommendations that have been coming down the pike. And now they say that older Americans shouldn't be treated for hypertension with medication unless their blood pressure is 150 over 90. No longer 140 over 80 or whatever. That seems rather high to me. I know what their justification is. So they say that people take these blood pressure medications and they might fall, they might faint, and they'll break bones. They'll wind up in the hospital. But isn't 150 over 90 kind of pushing it?
Yeah, so it's interesting because I was hoping that the cardiologist will come up with the number, the top number, which is 150, is the systolic number. The diastolic one is the 90, and I was hoping that they would reduce 90 to 80. So instead of going to 150/90, I was hoping they would turn it into 140/80, because most of the heart attacks, Steve, it's the lower number that we care about as much. Now, what is the reason behind this is a study from JAMA that what they're saying is that a lot of people are taking these antihypertensive or blood pressure medications, and maybe we were overdoing it, and by changing the guidelines, we would basically getting a lot of these patients off the medications. The concept behind it is actually a good concept. This is very different than the screening for prostate cancer, which is completely a false information, or mammogram. In this particular situation, they mean well. Whether it's the right direction, we'll find out. The truth is, we want people to really get their blood pressure down, not by medication, but by exercising, by sticking to vegetables, fruits, staying away from dairy, get rid of the red meat or limit it as much as you can. That's the way you would lower your blood pressure. Ultimately, the medications are there. They have side effects. But whether it's 140/90 or 150/90, there's not a lot of studies to really show where you have to put the cutoff. The other thing that I want people to know is that one blood pressure is not going to be the way that shows you have blood pressure. You got to get 3 separate blood pressures, different times, to make sure that you have a diagnosis of blood pressure. So if you're going to run up to your doctor's office and immediately you sit there and the doctor measures your blood pressure and that's high, you don't have blood pressure. Repeat it the second and third time, and that's something that a lot of people may or may not know. We'll see which way this guideline is going to go, but the concept, the big picture is stick to healthy diet, good exercise, devote your time to really eat healthy stuff, and that should keep your blood pressure low.
Well, we're talking to Dr. David Samadi here on the Steve Malzberg Show. You watch him on the Fox News Channel Sunday mornings at 10:30 on House Calls, and he is also the chair of urology and chief of robotic surgery at Lenox Hill Hospital. Okay, so eat healthy. So I eat a lot of chicken. I buy thin sliced chicken breasts at the supermarket, usually Purdue, sometimes Tyson, if they don't have Purdue, whichever one is 40% off for the week. And now I read that about half of the raw chicken breasts in the country, according to a sampling carried out, are carry antibiotic-resistant superbug bacteria. And if you get sick with that, they can't give you an antibiotic to get rid of it. Now, I'm very careful. I'm out of my mind when I clean the chicken. I rinse it off, and if I put it away to freeze it, I clean and I double clean and I triple clean. But this is disturbing nonetheless, isn't it?
Yes, it's absolutely crazy, and we also covered this in a different way on Fox News last Sunday. And what I said was that, unfortunately, our food chain system is completely poisoned. The history behind this is that they started giving antibiotics to get rid of some of these E. coli in the gut of cows and chickens or whatever it is. And they found out that over the years, some of these antibiotics not only get rid of these bacteria, but it made them grow faster in a shorter period. And so now this is a financial gain for a lot of farmers and agriculture out there.
Right.
So these antibiotics over the years has gotten into our food system, and you and I are getting them, and we're building resistance. So that's one of the reasons behind all these superbugs in the hospitals, in our bodies, and none of these antibiotics are working. Years ago, when we had a bug, you would have the sensitivity culture, and you would see most of them were sensitive. Now you see all these R's next to these resistance. So this is one of the downfalls of using all of these antibiotics. FDA needs to get involved. This should be completely banned. It's completely abused. And for the short term, I would tell you, try to stick to organic food as much as you can with the labels that says specifically no antibiotics has been ever used, and that's what I would do for the time being. Right. It's really disappointing news.
And if you, no matter what kind of chicken you use, I mean, that's one thing you got to really, I guess, be clean and cook it. Make sure you cook it thoroughly, and there's no red tint to it. Otherwise, put it back and don't eat it.
That's right. And with a high temperature of 130 degrees centigrade, you can get rid of a lot of these bacteria. And again, these superbug bacteria that come from food and other places, where doctors are really having a tough time treating them. So be very careful and follow exactly how you do it. Make sure that you don't mix it with other dishes, and keep it clean and washed and all the things that you recommended. Absolutely.
All right, now tell me what the heck the chikungunya virus is. 10 people on the French side of St. Martin's in the Caribbean have gotten it, and they say it's likely to end up in the United States. It's carried by mosquitoes, and supposedly it could land you in bed moaning and groaning in pain for days, which this is something brand new to us anyway, right?
Yeah, so this is a new virus that's coming in. I'm not going to even attempt to pronounce it. You did a good job. But,
no, I did a bad job, actually.
It looks like that, whether it's going to make it to U.S. or not, we're keeping an eye on this. But it's not lethal, it's not life-threatening. That's a good news. It's mostly causing joint pains and headaches and so on and so forth. So I don't think there's anything in the near future to worry about, but we'll see, whether it's going to find its way to U.S. There are only 10 cases so far of this virus contamination, so I wouldn't worry about it.
All right. I'll cross that off my hypochondriacal list of concerns and move something else up onto the list. I don't know what yet, but I'll think of something.
I was able to at least solve one of the 4 problems for you.
Doc, have a great holiday, and we'll see you next week. And thank you. We'll watch you on Fox News Channel Sunday at 10:30.
Happy and a healthy New Year to you,
You
Steve.
too. Take care. Dr. David Samadi, ladies and gentlemen, Chairman of Urology and Chief of Robotic Surgery at Lenox Hill Hospital here, as I should mention, in New York City. Because not everybody, knows where Lenox Hill Hospital is, although it's one of the finest hospitals in the country. So you should know if you don't know. No, I agree with him about the vitamins, and people could overdo it. When the studies come out, when the study came out about vitamin E possibly contributing to, in a negative light, too much of it, and also selenium. I understand selenium can increase blood sugar. So I take those every other day, the E and the selenium, as an additional supplement to my multi. And I also, the fish oil, I went back from 3 pills a day. I take 2 pills a day. So I'm an informed consumer when it comes to my health. And, your health is in your own hands. My good friend, Dr. Fred Vanini, here in New York, that was his slogan for his radio show, still is, your health is in your own hands. And no matter how great your doctor is, and I've been blessed, I've known some great ones over the years, I still do. But they have a lot of patience. They're not just concerned with you. And you have to be in control, and you have to know when your last thing was and your last test and what you're due for and what you want on your blood tests. And, it doesn't hurt to be that proactive when it comes to your health. It really doesn't. Okay, so what's ahead on the so-called Steve Malzberg show, you ask? Well, I'm glad you asked that. We're going to talk to a security expert about this Target fiasco coming up right after the break. A cybersecurity expert. 40 million people with their credit card information now in danger. Not just the number. We're talking about your address, your social security number, your PIN number, the whole thing. And I'm going to ask him about this report I saw where people are starting to get, and supposedly it's going to get much worse in the next year, a message will come on a box on your computer screen and say, you pay us X amount of dollars or we're going to wipe out your hard drive. And they have a countdown clock. And you have to transfer money to them through this computer bit money system, or they wipe out your hard drive. So we'll talk to him about that, see if it's legit or not. All right, Steve Malzberg Show right here, Newsmax TV and radio.